I'm Diane Macedo. Thanks for streaming with us. We begin with a tragic pandemic milestone. The White House reports 1 million American lives have been lost to COVID-19. We have a live look at the White House flag now flying at half-staff. President Biden spoke today with world leaders at a virtual summit on the pandemic, and earlier he released a recorded message to Americans.
This pandemic isn't over. Today, we mark a tragic milestone here in the United States. 1 million COVID deaths, 1 million empty chairs around the family dinner table. Each irreplaceable losses. Each leaving behind a family, a community, forever changed because of this pandemic. My heart goes out to all of those who are struggling.
The milestone comes more than 2 years after the first COVID cases emerged in the U.S. And as President Biden announced some new efforts to fight the pandemic, the next steps come with significant and immediate challenges. Let's bring in ABC News medical contributor and Stanford Health physician, Dr. Alok Patel, along with ABC's Kenneth Moton in Washington for more on this. Dr. Patel, some doctors and other frontline workers have said that they haven't been able to take the time to process these vast number of deaths because there's been this never-ending rush of sick patients coming in. So how important is that processing time, and what kind of fallout do you think we could see from not having it?
Diane, it's extremely important. I mean, as we face this unsurmountable, incredibly, possibly the most humbling slap in the face in the history of public health, we have to pay attention to what healthcare professionals have gone through. And as you mentioned, doctors are still overburdened. Nurses, technicians, secretaries, environmental services, everybody working in a hospital. And it's not simply from COVID-19, it's from everything else also surrounding our healthcare infrastructure. And we have to remember that when we look at these 1 million deaths, it's hard for me to even say the words. We also have to consider how many other indirect casualties they've been from overburdened hospital systems, while we still have so much burnout among professionals. And I'm just going to be completely blunt, the solutions are not in place. The solutions in terms of making sure that we don't have a healthcare professional shortage and we have a more efficient healthcare system moving forward, that plan has not been seen yet. So a lot of people, a lot of healthcare professionals out there are not only feeling emotionally drained, there's a certain lack of optimism right now moving forward.
Now, Kenneth, the president addressed these 1 million lives lost today and called this a new phase in the fight against this pandemic. What does he mean by that?
And it's a critical next phase because the health experts continue to point out, Diane, that if the world wants to get out of this pandemic, that much of the world will have to be vaccinated, will have to be boosted. And so you heard President Biden address that and say that we also, as a country, need to step up our efforts to share COVID-19 technologies with the World Health Organization and other nations as well, because this pandemic has really shown how interconnected we are. And if we want to prevent travel restrictions, if we want to end those supply chain problems, this has shown us that we have to connect here. We have to help each other as well. And if we want to stop all COVID-19 related deaths, President Biden reminding people that this is a global issue and that we all have to figure this out together.
And Kenneth, looking at some of the things that he detailed, you mentioned sharing technology with the World Health Organization. Also, he mentioned stepping up antiviral access to antiviral treatments and rapid testing. What kind of an impact is the White House hoping those measures have?
Well, they're hoping for some good news by sharing with the World Health Organization and other countries here because they know that this is a complicated situation when it comes to sharing across borders, that there really could be some logistical challenges here, especially as we deal and the world deals with supply chain issues. But it's hoping by communicating, sharing what COVID-19 technologies our doctors have explored, our scientists and researchers are working on here that can help other countries, because I mentioned minutes ago about travel restrictions. That has an impact on economies across the world, including the economy right here in the U.S., and President Biden knows that.
Sure does. And Dr. Patel, Moderna has confirmed to ABC News that it has finished submitting data to the FDA on vaccines for children as young as 6 months old. When do you think we could see that approval, or authorization, I should say, come through? And how significant do you think that would be?
And I think the approval, if it does happen, if we do see that clear safety and efficacy data, it's going to happen at some point in June. There are a few meetings planned by the FDA and the Independent Advisory Committee. And it's important for people to understand that this is a vaccine. Not only the approval is set for 6 months to 6 years, but also with Moderna, 6 years to 11 years old. Now, with 6 years to 11 years old, one thing that people will be looking for is what they call an immunobridging study. Translation, they see a rise in the antibody level in this age group, and they compare that to what we've seen in adults. And I think a lot of parents out there for kids under the age of 6 are paying close attention because they want to get their kids protected. They want that option. But with regards to, are we going to see a huge bump in that age group of 6 to 11, I'm not so sure, to be completely honest, because we have a vaccine available for that age group from Pfizer, and less than 30% of eligible children have gotten that. And so, we want to see that number up. And I think in order to do that, we're going to have a lot more dialogue, obviously dispel some misinformation, which seems like the song of this entire pandemic, and make sure we listen to parents' concerns and we address them directly.
All right, Dr. Alok Patel, Kenneth Moton in D.C. for us. Thank you both.
Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.